Sharon Gentry, and I got to breeze past this because I only got 6 minutes. The state of the NON. Last year, I kind of gave everybody an overview, for those of you who are here, about the association, about some of the things we're doing. This year, I wanted to kind of update, let everybody know where we stand, also let you know where we're going. And I'm happy to answer any questions at our booth, booth number 1, which is the first booth as you're walking on the right. So please do stop by. I'm more than happy to answer any questions you might have. So the facts are this. We've been in existence for 2 years, 5 months. We are the largest nurse and patient navigator association in the world with over 1,900 members. 1,900 members in 2 years. And I think that goes to the point that navigators have been starving for a place to call home. Navigators have been starving for a place that's going to keep this profession going in the right direction. We have a recognized journal now, which you'll all be receiving as part of your member benefits, the Journal of Oncology, Navigation, and Survivorship. We have a growing support for and respect from various members of the cancer care community, not only our corporate members and platinum sponsors, but other associations like Livestrong. Andy Miller, who's the Executive Vice President of Mission, will be here talking to you about patient advocacy this afternoon. He's going to have a great presentation. I'm going to energize all of you. We're talking a lot of the nonprofit advocacy groups, and we're also talking to a lot of other associations like the ONS and also ALSW and various other organizations. I'd like to thank the Leadership Council because without these 8 people, I wouldn't be standing here, you wouldn't be in this room, and this conference wouldn't be as fantastic as it's been. So I do want to commend them and give them a round of applause. Just real quick, I think it's important to highlight a piece of our mission. I'm not going to go over this. All of you can see this on our website. The last bit of this is very focused towards patient care and quality of life. And I think one key thing that all navigators really do care about is that they're passionate. They're passionate about providing patient care and making a difference in patients' lives. And not that oncology nurses don't do that, but I think all of you have taken up another mantle in the role that you're performing for patients and putting that hat on every day and really caring for those patients in a way that goes above and beyond the call of duty. So I do commend you for that. And I have tremendous respect for all our members. I'm so proud to be able to serve this organization, and I really do want to stress the fact that we are here for you to make your organization, AON, a better organization for you. Anything we can do, we're here and happy to do it. All right, so our 2012 commitment. This is the 3 E's. We're going to engage our members better and the entire cancer care community. We're going to educate more, and we're going to empower everybody. Those are our 3 kind of core goals for this year coming up. And the ways we're going to do that are community engagement. Committees I talked about last year, the only one that's come to fruition at this point is the research committee, which has 3 members. We're looking for people to join these committees, to come out of their membership, to come and be a part of the leadership, to work on education like this conference, and other initiatives we have, to figure out new ways of engaging our membership and making sure our members are happy, to advocate in the role, and also providing a face for our organization to the world, and also nominations. One of the key things we're moving towards is changing our governance to make it more formal, and you'll be seeing that over the next couple of months. Groups, I think one key thing we learned last year, key thing we're learning already this year, is that everybody enjoys networking with other navigators who treat the same areas that they treat because they understand the same things that they're going through. One of the things we want to do is get group leaders and kind of have a listserv for those people to go to, a place for those people to go to ask those questions throughout the year. We can definitely set up webinars for those groups as well. So anything we can really do is key. Practice setting academic, rural, suburban, special patient populations. I think all of these areas, by interest, I think all of these areas are places where we can facilitate better networking, where we can also make sure that everybody's needs are being met and being heard in the organization. And I'd like to recognize our 2 chapters currently in North Carolina and Arizona. Next year we're going to be in Phoenix. So mark your calendars, 14th through 16th, it's in your program book. We're going to be in Phoenix, Arizona at a lovely resort. So we're going to have a lot of fun out there for our 3rd annual conference. And anybody else who's interested in starting or has a chapter, we're definitely open to hearing that. Sharon Gentry is actually kind of the chair of that initiative as well. And the Journal of Oncology Navigation and Survivorship. We just want to recognize the editorial board and the research committee for their dedication. You've seen these publications. There's back issues available in the exhibit hall at our booth if you'd like to pick up a copy. Real quick, our 2012 education initiatives. Chapter meetings are going to do more in-person and more virtual presentations. We're going to create a video resource microsite within AONM to provide you stories of navigators, to provide you stories, best practices, and different things of that nature. Monthly webinar series we'll be conducting. So if you have topics you want to hear about, please let us know. Supplements to the journal, a curriculum for navigators, so an education plan for navigators who are interested in furthering their skills, and also just learning about other areas such as research, and potentially ground-scale publications. The growing support we have in Pfizer Oncology and Lane Pharmaceuticals, and our partners, which I can't underscore enough, the Oncology Nurse, who have been there from day one, and Health Monitor is a new patient education resource partner for us. There are actually meetings in the hall. Please feel free to stop by them. You'll all start receiving that, those resources